Hi, I'm Chris, and today I'm going to briefly show you how to perform a 6-minute walk test. This is a submaximal test of aerobic capacity and endurance. To perform this test, you will need the following: stopwatch or timer, a worksheet for counting laps, a pulse oximeter, Borg breathlessness scale, a Borg rate of perceived exertion scale, emergency equipment such as a telephone or oxygen source, a chair in case the patient or participant needs to sit at any time, and most importantly, a 30-meter or 100-foot unimpeded hallway with markers to one side at every 3 meters. This will simplify the calculations of the distance traveled. Contraindications to performing this test include unstable angina, myocardial infarction within the last month, a resting heart rate of greater than 120 or less than 50 beats per minute, if at any time the systolic blood pressure is greater than 200 or less than 60 millimeters mercury, or if diastolic blood pressure is ever greater than 110 millimeters mercury. Also, if a resting oxygen saturation is less than 88%, with the exception being participants of long-term oxygen therapy. Reasons for immediately stopping the test include if the participant's oxygen saturation falls below 80%, if they ask to stop the test, if they experience chest pain at any time, intolerable dyspnea, leg cramps, staggering, diaphoresis, or pale ashen appearance. Prior to the test, you will need the participant to sit for a minimum of 10 minutes so you can get a resting heart rate, blood pressure, and oxygen saturation. During this time, I would use it to explain the Borg breathlessness scale and the Borg rate of perceived exertion. You also need to make sure the participant knows what's expected of them in the exam. There's a very specific script you're supposed to read for this to standardize the exam. It goes as follows. The object of this test is to walk as far as possible in 6 minutes. You will walk back and forth in this hallway. 6 minutes is a long time to walk, so you will be exerting yourself. You will probably get out of breath and become exhausted. You are permitted to slow down, to stop, and to rest as necessary. You may lean against the wall while resting, but resume walking as soon as you are able. You will be walking back and forth around the cones. You should pivot briskly around the cones and continue back to the other way without hesitation. Now I'm going to show you. Please watch the way I turn without hesitation. At this point, you would demonstrate the procedure to ensure that the participant has no questions.
The participant can begin whenever they feel they are ready and walk at a safe pace.
At the end of the hallway, the patient should encircle and pivot the cone as briskly as possible. At the 6-minute point, you will order the command of stop. This will be the distance that you mark and calculate the total distance traveled.